evening, one and all. This is Asadi Srinivasulu, PhD Research Scholar under Professor Anupam Agrawal at IIIT Allahabad, Indian Institute of Information Technology, Allahabad. Today, I would like to demonstrate my idea on VIDIAM++, means viral disease prediction and multimodal approach we are using for AI assistant for developing privacy preserving viral diagnosis in resource limited settings by using a CT scan and X-ray images as input. We are collecting from the AIMS Delhi with the help of one Ananta Mohan professor sir. We are running our program in federated learning by using the concept, and these are the contents I would like to present in front of you. The sequence: introduction, problem statement, proposed solution, innovation and uniqueness of my idea, presentation, implementation, that is prototype, scalability and impact, a team introduction, conclusion, and a call to action references. So my team member is I am taking guidance from Professor Anupam Agrawal. And we have done nearly 4 to 5 SCI papers on this same topic, and we got an idea why don't we can implement one idea presentation. That is our proposed framework like VIDAM++ is a integration of leveraging with the federated learning multimodal AI assistant that securely fuses imaging and clinical data like chest X-ray images and CT scan images to deliver rapid, and we are getting very good accurate viral disease screening in resource limited settings. We are using multimodal AI in medical diagnosis, and we are taking X-ray images and CT scan images as input to our idea presentation. And we have tested with 5,000 images collected from Kaggle and GitHub for testing purpose. 80% of images we have used, and 20% of images we have tested for testing purpose, and we are predicting improved medical diagnostics. And we are running with federated learning. Even we can access this one in rural and low resource setting remains limited by using RT-PCR is costly and slow, and many AI tools like transparency and generalizability necessitating a real-time privacy preserving multimodal system for reliable viral disease screening. So we have our own idea like we are collecting data from real-time from hospitals like AIMS Delhi, and then we are choosing pre-processing, then performing various latest technologies, inclusion of CNN, RNN for prediction, for classification, and we are integrating with various frameworks like Keras, TensorFlow, PyTorch, etc. And this is the proposed solution. So far we have done a literature survey and a prototype, and our idea we are going to implement soon in our IIIT campus by providing all amenities and money we are expecting from our institute IIIT and government. We are writing proposal on. We are applying GAN based augmentation, generative adversarial networks for especially in CT scan and X-ray images for deployable low cost edge devices to deliver rapid and privacy preserving viral diagnosis in the field. And these are the patient metadata we are taking as a symptoms, age, gender, and what type of input image we are giving. Then we are choosing the multimodal, then we are choosing the deep learning CNN model and explainable AI and federated learning, transfer learning, and we are integrating all sort of leveraging into our proposed model. And finally we are getting the feasible and privacy preserving idea we are going to solve. This proposed framework like VIDAM++ indicates we are integrating various models like federated multimodal learning on chest X-ray CT scan image, and with generative adversarial network based on augmentation and built explainability to deliver privacy preserving and edge deployable viral screening. Here we are taking as input images, chest x-ray images and CT scan images. Then we are applying WOTSU for WOTSU algorithm for dilation and erosion for images, then normalizing data, then data augmentation. The implementation plan, we are planning our idea with Nano and Raspberry Pi prototype. We will conduct this experimentation 3 to 6 months. PHC and mobile van pilots with the federated rollouts using low cost edge devices, curated X-ray and CT scan data sets, and internet of multimodal link we are using for clinical partners. Then we are checking the feasibility, then timeline like 3 to 6 months, and the resources we are using from our campus and the laboratory. And this is the scalability impact. So if you increase the size of the viral diseases, number of types and number of input types also we are giving as input to the system is going to predict and detect and classify for labs and imaging centers and startups and public health partners. And this is my team members we are doing in our campus. Myself, Asadi Srinivasulu, working as a PhD student under Professor Anupam Agarwal, and I'm using a federated multimodal AI with GAN augmentation and explainable AI for edge deployment. My professor is giving a continuous support and guidance for system design, prototype, validation, and partnerships. And we are expecting advisors from our idea, oversight and institutional coordination for implementation. And I'm concluding my idea presentation. I'm taking different types of viral diseases with the CT scan and X-ray images. Not only this pneumonia, COVID or different viruses, also how easily we can find out and predict what type of this viral disease type and severity, and how easily we can implement by using this idea with low cost. We are planning a built-in explainability and federated learning. And if our INNOSTORM judges and partners support for PHC mobile van pilots, mentorship and deployment partnership to scale our proposed model for rapid privacy preserving viral screening in under-reserved regions. And this is my idea, and I'm concluding my session, this idea presentation. And any queries if you have, I'm going to clarify. Thank you, madam, for giving this opportunity. BITS Pilani and Triple IT Allahabad for giving me this idea presentation in front of us. Thank you. Any doubts related to this idea presentation, you can ask me.
Thank you. So, do you have any questions?
No.
Okay. So, with that, we end this session. Thank you everyone for joining. The results will be declared soon through your mail, and you will get the feedbacks in case you do not win.
Okay, ma'am.
Thank you everyone for being there.